Hypnotics. This is the downer aspect of the uppers, downers, all arounders. So here, let me aim myself. There we go. Okay. So we're going to talk about opiates and opioids. One of the things that we're going to talk about is what celebrities have died using overdosed on these things. And we're going to be talking about some of the same people because they mix their drugs. So let's go ahead and get started. There we go. Chapter 4, Opiates, Opioids, and Sedative Hypnotics. Depressants depress the activity in the central nervous system. They sedate, they cause muscles to relax. They may depress inhibitions, emotions, impulses. They may mimic the natural inhibitory neurotransmitters, endorphins, enkephalins, and gamma aminobutyric acid, also known as GABA. There are three major classes of downers: opiates, opioids, sedative hypnotics, and then alcohol. But we'll be talking about alcohol next week. Alcohol has a chapter of its very own. Four minor classes of depressants: skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. Opiates, opioids include opium, morphine, codeine, hydrocodone, also known as Vicodin, oxycodone, also known as OxyContin, methadone, and heroin. Those are the opiates, opioids. You can add fentanyl to that if you like. Originally developed as painkillers, cough suppressants, and diarrhea treatments, they do work for those things. Sedative hypnotics are synthetic chemicals developed to treat anxiety and insomnia. Naproxamate, also known as Miltown, phenobarbital, Seconal, Doradin, methaqualone, also known as Quaalude, flunitrazepam, which is also known as Rohypnol, GHB, which is another date rape drug. Rohypnol is a date rape drug. Benzodiazepines such as Xanax and Valium. Alcohol is a natural byproduct of the fermentation process of plant sugars or starches. This is the oldest psychoactive substance used by humans. Alcohol is the world's second most destructive drug after tobacco. Number one, tobacco. Number two, alcohol. Skeletal muscle relaxants are synthetically developed central nervous system depressants that target the area of the brain responsible for muscle coordination and activity. Quercesoprodol, also known as Soma, chlorzoxazone, paraffin forte, clobenzarine, Flexeril, baclofen, lioresal, methocarbamol, Robaxin. You probably know these as Soma, paraffin forte, Flexeril, and Robaxin. I'm not sure what lioresal is. Antihistamines found in cold and allergy medications to block the neurotransmitter histamine. Synthetic drugs used to treat allergic reactions, to prevent ulcers, prevent shock, prevent rashes, prevent motion sickness, prevent symptoms of Parkinson's disease. Those are the antihistamines. Over-the-counter depressants, sleep aids or sedatives, Nitol, Sleepies, Sominex. Active ingredients are scopolamine. That's the truth serum. Antihistamines, bromide derivatives, and alcohol. That's what's in your over-the-counter depressants. Look-alike depressants are rarely seen today. They're outlawed in the United States. You might see them overseas if you ever travel in Europe or Africa or South America, but they're all outlawed in the United States, and we rarely see them. South Africa is big on look-alike sedatives. Opiates are products of the opium poppy. That's what an opium poppy looks like. Opioids are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower. And there you go. That's exactly what's going on there. It will ooze for about a week. It can be milked about 6 times in any given season. So there you go. Opium produces over 25 alkaloids, and the two most important are codeine and morphine. Codeine makes up 0.7% to 2.5% of the opium exudate. Morphine makes up 10 to 20% of the opium exudate. A third alkaloid that is a stimulant rather than a depressant is thebaine. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. And these include heroin, hydrocodone, also known as Vicodin, oxycodone, which is also known as Percodan and OxyContin, and hydromorphine, which is also known as Dilaudid. Fully synthetic opiate-like drugs, methadone, meperidine, also known as Demerol, and propoxyphene, also known as Darvon. I'm not sure why fentanyl isn't in here. It's a fully synthetic opiate drug. Synthetic opioid antagonists, naltrexone and naloxone. Opium poppies were first cultivated in ancient Mesopotamia. It then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the Old World, but its ills were seen even then when various writers wrote of its addictive properties. Opium tended to be used as an additive, eaten, chewed, or mixed with liquids, and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture. Tincture means they mix it with alcohol, with opium powder, and this became known as laudanum. He used it to treat dysentery, pain, diarrhea, and coughs. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric is the tincture of opium with camphor. It was developed for the treatment of diarrhea. This mixture is still used today. Paregoric. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredient into the system faster, in about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, there's a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tinfoil and inhaling the fumes through a straw. This is known as chasing the dragon. And that's what it looks like, chasing the dragon. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more active painkiller. Morphine was first used in the Crimean War from 1853 to 1856, and then during the American Civil War. Opium poppies were actually grown in the South to provide morphine for the Confederate troops. In 1832, the weaker alkaloid codeine was isolated from opium. It was found only to be twice as strong as a painkiller as opium. Codeine was used to treat coughs and general neuralgia. In 1874, a British chemist boiled morphine from acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. Its effects were heroic on the individual. Bayer marketed it as a cough suppressant, a chest painkiller, and a treatment for tuberculosis and pneumonia. Heroin crossed the blood-brain barrier more rapidly than morphine. The result was a more intense and rapid rush and euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half the opium addicts were women, 56 to 71%. Famous, famous opiate addicts in the 19th century, Jane Addams, who started the social work movement in Chicago. Famous Sarah Bernhardt, who was an actress. Elizabeth Barrett Browning, who was an author. Charlotte Bronte, who was also an author. Elizabeth Barrett Browning was a poet, and Charlotte Bronte, of course, was an author. She either wrote, one of the Bronte sisters wrote Wuthering Heights, and the other one wrote Jane Eyre, and I can never remember which one is which. Louisa May Alcott was an opiate addict in the 19th century. Samuel Coleridge, you know, Louisa May Alcott, of course, was an author. She wrote Little Women and Little Men. And then Samuel Coleridge was a poet. Charles Baudelaire was a author. He wrote books, and I don't know any of his books. Lord Byron was a poet. John Keats was a poet. Edgar Allan Poe, of course, was the famous mystery writer, first mystery writer. Wrote The Raven, Cask of Amontillado. Algernon Swinburne was an author and a poet. Opium, morphine, and heroin became a health concern in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed, limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. By 1924, heroin production was outlawed in the United States. In 1915, only 63 of the people incarcerated in federal prisons were incarcerated for narcotics violations. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations, about 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses, 155,900 prisoners out of 180,328. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. The Chinese triads, the mafia, the French connection, Mexican narcotraficantes, African traffickers, Russian mafia, and Colombian cartels. At present, 4.6 million Americans use opioids illicitly every month. Only 136,000 to 800,000 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers of oxycodone, also known as OxyContin, and hydrocodone, also known as Vicodin. A new wrinkle that is appearing in the Dallas area junior and high schools is cheese, a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. The mixture gives the individual a rush. Several deaths have caused a nationwide scare because of cheese. Worldwide, 5 to 10 million people are regular heroin users. The U.S. only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. 92% of the world's heroin is produced in Afghanistan. Most of the world's legal opium for pharmaceuticals is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opioids are prescribed to deaden pain, control coughing, stop diarrhea. Non-medically, opioids are used to drown out emotional pain, get a rush, induce euphoria, prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. The P stands for peptide. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, endorphins, enkephalins, and dynorphins. The endogenous painkillers occupy the substance P receptors, opioid receptors, referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. It decreases anxiety, it produces a sense of detachment, it makes the individual feel drowsy, it deadens the unwanted emotions. These effects occur because the inhibiting effect of the endogenous or exogenous painkillers affects on the locus ceruleus. Once again, we have the locus ceruleus. Opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, inhibiting the action of GABA, triggering glutamate receptors, enhancing dopamine neurons in the reward reinforcement pathway, increasing the release and enhancing effect of dopamine. Heroin has the strongest effect on all the opioids. The reward reinforcement pathway performs two functions. It signals pleasure so that an act is more likely to be repeated. It signals the alleviation of pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs, especially opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. When an individual is prescribed opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opioids will use the drug in excess to prevent the withdrawal symptoms they are seeking to return to the normal state. Opioid and opioid-like receptor sites have different functions. Mu and sigma receptors trigger the reward reinforcement pathway, block pain transmission, change mood, cause pupil contraction, depress the autonomic nervous system, respiration, and blood pressure. The kappa receptors induce dysphoria, induce endocrine changes, control pain at the spinal cord level. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. Robitussin AC and Vicodin syrup. People will have used these substances for the psychedelic effects. Unfortunately, an overdose of the psychedelic substance dextromethorphan can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepines, and antidepressants. Opioids are also given to control diarrhea. Opioids works on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opioids addicts may suffer from severe constipation. Opioids affect every part of the body, but especially your heart, your lungs, your brain, your eyes, your voice box, your muscles, cough center, nausea center, reproductive system, excretory system, and immune system. Physical side effects of opiates, opioids, but especially heroin, includes insensitivity to pain, lowered blood pressure, lowered pulse, lowered respiration rate, confusion. A stronger dose, at stronger doses, opiates, opioids, but especially heroin, might cause droopy eyelids, nodding head, slowed, raspy speech, slowed coordination and walking gait, pinpoint pupils, histamine release causing itchy, dried skin, suppression of the cough center hindering the clearance of phlegm, vomiting due to the activation of the nausea center, severe constipation, delayed menstruation, reduced testosterone production in males, dulled sexual desire uh, to the point of indifference. How do we identify somebody when they come into the emergency room? Right here, we look at their pupils. If they have pinpoint pupils. We check them for a lot of other things to make sure it's an opioid overdose. And then we give them Narcan. Tolerance for opiates, opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in the liver, desensitizing the nerve cells that the substance affects, increasing drug excretion by increasing urine, feces, and sweat output, alteration of the brain chemistry to compensate for the effects of the drug. Opiates, opioids tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. Chronic use of opiates, opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opiates, opioids will reduce the dopamine producing cells in the ventral tegmental area by 1/4. Hence, these individuals have less of an ability to feel pleasure or even to feel normal, another reason to take the drug. At this point, the body relies on the drug to feel normal. Withdrawal from opiates, opioids may take place in 3 stages. The acute withdrawal, the body tries to return to normal too quickly. The post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and the sleep problems that may persist for 3 to 18 months after use of the drug. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Decrease in blood pressure, decreased body temperature, decreased respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. Short-acting opiates, opioids, 2 to 3 hours result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. These include heroin, morphine, and hydromorphone, also known as Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. Long-acting opiates, opioids will delay the withdrawal symptoms for 1.5 to 3 days. That would include methadone and levo-alpha acetylmethadol, also known as LAAM. Peak withdrawal hits at the 4th to 6th day, and recovery may take as long as 2 weeks. Opiates, opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and long term. These opioids include codeine, oxycodone, also known as OxyContin, and propoxyphene, also known as Darvon. One of the key areas of withdrawal symptoms of opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by opioids. All in all, people rarely die from opioid withdrawals as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opioids withdrawal is the fear that the withdrawal, since this is the area of the brain that is mostly affected by the drugs. So it isn't the withdrawal symptoms themselves, it's the fear of the withdrawal symptoms because it affects the area of your brain that is paranoid. Neonatal effects of opioids usage are extreme because the drug readily crosses the placental barrier. Pregnant opioid users are at greater risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. Eclampsia has to do with uncontrollable high blood pressure. If the fetus survives these dangers, it will be just as addicted at birth as the mother is, though due to size and dilution factors, the withdrawal symptoms are more severe. Low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. If the neonate survives the withdrawals, the effects will last for 5 to 8 weeks. And as I think I told you before, I had a niece that gave birth to a heroin addicted baby, and it took the baby 6 to 10 weeks to get out of the hospital. The baby almost died. Now it has anger issues. It will never be normal. The other thing to remember about these individuals is the high-pitched cry. Sounds like a cat screaming, and it's constant because the infant, is in such grotesque pain. In the early 21st century, 4,000 to 5,000 people died from opioid overdoses every year. Last year, 130 people died from opioid overdoses every day. That's 47,450 people. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. In one study, only 57% of the opioids were accidental. People were taking them on purpose. 2022 to 2023 looks to be the deadliest overdose death year by date. From April 2022 to April 2023, 111,355 people died of accidental overdoses in the United States. 70% of the deaths were due to fentanyl and other synthetic opioids. 13 were due to psychostimulants. 1/4 were due to cocaine overdoses. What opioid overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins. And this is when you give them Narcan. If you give them Narcan, it blocks this whole thing, the whole process, and they survive. Tony Hawkins, drummer for the Foo Fighters, overdosed on opioids, benzodiazepine, tricyclics, and THC. Juice WRLD, rapper, overdosed on Percocet. China, pro wrestler, overdose, oxycodone, oxymorphone, temazepam, and diazepam. That's Xanax and Valium, the last two. Corey Monteith, Glee, overdosed on heroin and alcohol. Mac Miller, American rapper, died of an overdose of fentanyl, cocaine, and alcohol. Art Bell, American broadcaster, died of an overdose of oxycodone, hydrocodone, diazepam, and carisoprodol. Carisoprodol. Not sure what that is. Peaches Geldof, daughter of Irish rocker Bob Geldof. She played on her celebrity as a TV personality and a model. Having witnessed her own mother's overdose when she was 11, she also overdosed on heroin in front of her 11-month-old son. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. A look at individuals who have only shot up from for a year shows a rate of 71.4%. 20 to 40% of those infected will develop liver disease. 4 to 16% will develop liver cancer. And we do have a treatment for hepatitis C. It's relatively new. It's only been around for 2 or 3 years, but now we can treat it. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of children with HIV have had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins being used for injecting, so that the individual has to go to more and more difficult sites for their fix. The wrist, between the toes, the neck, even the dorsal vein of the penis. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. Staph aureus, beta strep, group A are common in these individuals who are immunocompromised. There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where a virulent bacteria gets under the skin and eats tissue away. Endocarditis, bacterial infection of the heart valves, and cotton fever, short-term bacterial infection. This obviously is necrotizing fasciitis. Why does this individual have it? Because he's immunocompromised. He was a heroin user. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age for first alcohol usage is 16.4. The mean age of first tobacco usage is 17.3. The mean age of first marijuana usage is 17.4. The mean age for first heroin usage is 22.2. From first usage to daily habit averages, about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead, 50 to 100 times greater than the general population. They died from overdose, accidental poisoning, homicide, suicide, accident, and liver disease. 44% still used heroin, 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group that now averaged 57.4 years reported frequent interactions with the criminal justice system. Morphine is metabolized by the liver. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. Morphine will be detectable in the urine for several days after ingestion. 1 out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years, and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because fear of tissue dependence and addiction, fear that the painkiller would mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its number one ranking has since been taken over by Vicodin. Pimp C and DJ Screw dead from cough syrup overdoses. There you go. It was cool. That's what you did in the clubs in Los Angeles. If you were cool. Hydrocodone is also known as Vicodin, Hycodan, Tussin, and Norco. This is a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. Methadone or Dolphin, methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium to provide painkillers of similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts. Hydromorphone is refined from morphine, and gram for gram is 7 to 10 times more potent than morphine. Because of its potency, hydromorphone is stringently controlled, and this is the common name Dilaudid. Oxycodone is also known as Percodan and OxyContin. Oxycodone is a semi-synthetic derivative of codeine and is used for moderate to severe pain. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine and Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strength of the tablets. Meperidine, also known as Demerol, Pethidine, and Mepergan. Demerol has been around longer than most of the synthetics and semi-synthetics. It is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effects of constipation. This drug is the most widely abused by medical professionals, Demerol. Pentazocine, also known as Talwin, is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce its use as an opioid accelerant. This drug is rarely used now to get a high. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wyjezek. It is used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of the overdose deaths using opioids have been seen with propoxyphene. Fentanyl, also known as Sublamax, was the most powerful of opioids as it is 50 to 100 times stronger than morphine. It is used pre and post surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also an oral transmucosal tablet called Actic, meant to be dissolved in the mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. Unfortunately, some of the street drug contains NPTP, which kills the dopamine producing cells in the brain, resulting in Parkinson's disease at best, and at worst, a frozen addict who can't move for the rest of their lives. Ouch. Fentanyl overdose deaths. Prince Tom Petty had 3 different types of fentanyl in his system. Michelle McNamara died of a fentanyl overdose. She was the wife of this guy, and I can't remember what his name is, but he's a famous actor. Mac Miller overdosed on fentanyl, cocaine, and alcohol. Little Peep overdosed on fentanyl and Xanax. As if fentanyl wasn't killing off enough people, the Food and Drug Administration has approved Disuvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacture can cause an instant overdose. Oh, goody. LAAM is a long-acting opioid that is used for heroin replacement therapy. LAAM lasts for 2 to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every third day, take-home doses are unnecessary, as is the case with methadone. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. Naloxone and naltrexone are opioid antagonists blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effects of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naloxone blocks the effects of the opioid for up to 72 hours to help prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an inverse agonistic effect and will block opioids from receptor sites up to 30 hours. At high doses, it can be used as part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine is often used to diminish nausea, anxiety, and diarrhea from opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors and can cut withdrawal time in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery from 1 month to 5 days, also known as catapres. Butorphanol, also known as Stadol, and tramadol, which is also known as Ultram, are new synthetic opioids developed as less abusable or addictive analgesics. These drugs are still abused and have been classified as Schedule IV drugs. Sedative hypnotics are any drug that relaxes and soothes the body and the mind, also known as sedatives. It eases anxiety or induces sleep, and that is a hypnotic. The two main categories are benzodiazepines and barbiturates. Examples of benzodiazepines would be alprazolam, which is also known as Xanax, and clonazepam, which is also known as Klonopin. Barbiturates are the phenobarbitals, and we're going to talk about those in just a second. Just under half of all prescriptions for psychiatric medications are written for antidepressants. The first sedatives were bromides, also used as anticonvulsants in the 1850s. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could build up in the body. Around the American Civil War, chloral hydrate started being used as a sleep aid and a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, and pregnancy neuroses. It was also used as the original Mickey Finn to knock out men so that they could be shanghaied and taken to sea. In 1882, physicians began using paraldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms despite addictive properties and unpleasant odor. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. Barbiturates also are any compound synthesized from barbituric acid. That would be pentobarbital, psychobarbitol, and phenobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. Miltown, or meprobamate, was used fairly extensively as a sedative in the late 1940s into the 1950s. Became popular with housewives and came to be known as Mother's Little Helper. And there's a song by Rolling Stones, Mother's Little Helper, and they're talking about Miltown. Less dangerous than barbiturates, it maintained its popularity into the 1960s when benzodiazepines were developed. Doradin glutathamide was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as barbiturates. It is no longer manufactured in the United States. Librium chlordiazepoxide was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac. Thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves with just as dangerous withdrawals as barbiturates. And I do have a story about Librium and Valium during the Vietnam War. Librium and Valium were given to the wives of the soldiers that were overseas to cure their anxiety about their husbands. And I was working in a hospital in Texas, and we used to get Librium and Valium tablets in 5-gallon buckets. Everything else came in gallon containers or quart containers, but Librium and Valium came in 5-gallon buckets. Today there are several new drugs that are being, that was during the Vietnam War. Today there are several new drugs that are being advertised as less addictive: Lunesta, Buspar, Rosarim, Ambien, and Lyrica. Only Buspar and Rosarim have proven to be less addictive. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At this point in time, benzodiazepines are used sparingly, and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get high. However, sedative hypnotics can still be abused if the drug is overused when prescribed by a physician. It is used in combination with other psychoactive substances for the synergistic effect or counteractive effect. The drugs are borrowed or stolen from someone as a form of self-medication. The drugs are obtained by other illegal means, for example, forged prescription or buying on the black market. The list of celebrities who have died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nimbutal and chloral hydrate in her system when she died. Chloral hydrate is a molecule, 4 alcohol molecules stuck together. That's why it works. Dorothy Dandridge had the high levels of tricyclic antidepressants, imipramine, tofranil, also known as tofranil, when she was found dead. Jimi Hendrix was a notorious mixture of drugs. Hendrix had high levels of secobarbital in his system when he asphyxiated on his own vomit. The drugs were prescribed to his girlfriend and not to him. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller containing aspirin and meprobamate. You may remember meprobamate is Miltown. Freddie Prinze shot himself while under the influence of Quaaludes. Prinze was the star of the hit sitcom Chico and the Man. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was the sedative clomethazole. He had 10 times the daily dosage in his system when he died. Abby Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death was ruled a suicide. Steve Clark was the lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from the use of painkillers, Valium, antidepressants, and alcohol. Margot Hemingway was an actress and the granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide. Rob Pilatus, Millie of Milli Vanilli, died of a heart attack induced by a sedative given to him to help with alcohol withdrawals. He was taking the drug with alcohol. Whoops. Dana Plato, the actress from the sitcom Different Strokes, died from a mixture of Soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died after mixing tramadol, which is a painkiller, with cocaine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. The combination mixed with obesity created a fatal enlargement of his heart. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy, blonde, and Playboy bunny from Texas who shocked the world by marrying a one-foot-in-the-grave billionaire, died with 11 drugs in her system, including Ativan, Cirax, Klonopin, chloral hydrate, Lexapro, Valium, Noctec, and Zoloft. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: oxycodone, hydrocodone, Xanax, Valium, doxylamine, and temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, midazolam, and Valium. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of Valium, Vicodin, Soma, and haloperidol in his system. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with with a blood alcohol level of 0.416. And you'll remember 0.08 is legally drunk. Whitney Houston had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana in her system. Judy Garland had been a child star and had started a pattern of excessive workdays fueled by uppers and downers. At 47, she died of a secobarbital overdose. Philip Seymour Hoffman was a highly touted actor nominated for 4 Academy Awards, of which he won once. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines. Tom Petty was a rocker for 4 decades. He died at 66 with 3 forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kurt Cobain was the iconic frontman for the alternative rock band Nirvana. While cocaine died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janis Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from 1980 until his death in 2016. His album Purple Rain is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at 57. John Belushi was one of the major original players on Saturday Night Live. He played Joliet Jake Blues of the Blues Brothers. In 1982, Belushi overdosed on a speedball at 33. River Phoenix was a child actor from the late 80s who was headed for success, the star of Stand By Me and Indiana Jones and the Last Crusade and Sneakers. He died of a speedball overdose outside a club in Los Angeles at age 23. Chris Farley was a comedian of SNL fame. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero, John Belushi. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most physicians only use benzodiazepines as short-term fixes for specific conditions. In order of usage, the most widely prescribed benzodiazepines are alprazolam, Xanax, 34 million prescriptions in the United States, lorazepam, Ativan, 19 million prescriptions in the United States, clondiazepam, Klonopin, 16.7 million prescription in the U.S., diazepam, Valium, 12 million prescription in the United States, and temazepam, Restoril, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorders, reduce anxiety and apprehension in surgical patients, treat sleeping problems, control skeletal muscle spasms, control seizures, dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepine usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs, as they are used to lessen the effects of withdrawal symptoms, methamphetamines, cocaine, and heroin. In one study, 100% of benzodiazepine addicts were addicted to other substances as well. The typical benzodiazepine user is a white, well-educated, and 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, the cerebral cortex, and the limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and the metabolites tend to stay in the body for an extended period of time because they are extremely fat soluble. Alprazolam Xanax is used for generalized anxiety disorder, panic disorder, and depression. Triazolam halcyon is used for short-term treatment of insomnia, 7 to 10 days. Diazepam Valium is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than a younger person. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months or normal dosage over a year. Because of the drug's lipophilic properties, even small doses over time can cause tissue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms, exaggeration of the recurrence of symptoms, true withdrawal caused by low GABA and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day with short-acting benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepines, withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1970s. Rohypnol has been banned in the United States along with GHB since 1996. Buspar is commonly prescribed as an anxiolytic and in the combination with an SSRI to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug. Placidyl chloral hydrate, ectolorvanol is actually a chemical ether. Chloral hydrate is actually 3 molecules. I'm sorry, I said 4 molecules of ethyl alcohol fused together. Both of these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone. Its effects are sedation, disinhibition, empathy, sensory enhancement, and euphoria. Its effects last for 3 to 6 hours. GBL and BD, these drugs are metabolized into GHB. These two substances have been formulated into mint-flavored rave elixirs known as Blue Nitro, Revivrant, Gamma G, Rimforce, and Ensom X. Quaaludes effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effect lasts for 6 to 10 hours. This is a drug that is often abused in South Africa, Quaaludes. Lyrica, this drug is used to treat nerve pain from the shingles or diabetes and can be part of a seizure treatment. More recently, it has been used for the treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone. Rosarim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. Used for short-term treatment only. When taken with alcohol, the result can be toxic. Zalplan, Zopiclone, and Zolpidem. These 3 drugs are known as the Z hypnotics. These drugs are short-acting drugs with 1 to 4 hour half-lives. Excess use causes nausea, headaches, diarrhea, drowsiness. These drugs are rarely abused except with other drugs. And that is it. The 3 Z drugs are the last ones. So let me get out of here. There we go. Okay. Well, next week we're going to talk about alcohol. Always a fun week. So I'll talk to you next week.